Is being called to order. The first item on the agenda will be, please, all guests, please be reminded to sign in at the front door. Our first item on the agenda is review and approval of minutes dated Monday, January 19th.
Move approval, Aguilar.
Second, Erpenbach.
All in favor, say aye.
Aye.
And next will be review and approval of minutes dated Tuesday, January 17th.
Move approval, Erpenbach.
Second, Aguilar.
Any discussion? All in favor, say aye.
Aye.
All right, next on the agenda will be the family daycare ordinance revisions given by Jill Franken and her staff.
Good evening. Jill Franken, Sioux Falls Health Director. I want to thank you for taking the time today to visit and allow us to provide this presentation. I also have some folks here. Alicia Flura will also be speaking and sharing some information with you as well. We also have here Luann Ford and Paul Bankford. Josie. Are they on? Oh, that's on.
How's that? Well, should we start over? Okay, I don't need to start over. Okay. So in addition, we have Dr. Susan Randall here, who is with Voices for Children, and then also Pam Stefanich, who is with the Sioux Empire Child Care Network. I just want to let you know they are also in the audience. So today we're going to be talking about some proposed changes to the family daycare ordinance. First off, I'd like to do a review with you, and I know that you have this has been a busy day for you already, and you'll have probably a busy evening, so I'll try and be as brief as I can, but I do want to remind you of what's happened over the last year to year and a half. In 2010, 2011, we changed our inspection procedures for new daycares as well as in response to complaints. We had ordinance come through with all of you that happened within this last year and a half and made those changes and integrated that into our practice. We also revised our complaint processing and tracking. We did a review and we set and established a process by which we review and monitor daycares that have compliance issues. That's been internal process and procedure within the health department. We also have created and updated our violation, suspension, and revocation decision-making and documentation within the department itself. We've also increased the public notification of citations and suspensions and revocations via our website enhancements, as well as things such as letters to parents to notify them when things of that nature have occurred and issues are going on with their daycare. We also have made changes to our registration process to create a checklist within the registration and renewal process for providers so that when they come in every year, they have to check off that they understand the things that they're responsible for as it relates to the city ordinance. That some of which we have known over time when we have been working with daycare providers is oftentimes they just have an awareness, they may have an awareness issue, they may be a fairly new provider to the community, may not quite understand all the ordinances in place and the requirements that they have to meet, and so we put a checklist in place to help assure that that is on an annual basis reviewed with them. Also, to continue, we have also, as I mentioned before, we have really updated our website and created some enhancements to that. So now you can find citations as well as other enforcement action on our website. We've also increased the searchability of the website so it's much more user-friendly for parents, people in the community that might have an interest in knowing about something about a certain daycare. And then also we've partnered with 211 Helpline to offer parent education classes in the community on how to properly evaluate a daycare and select a daycare. 211 has always been a really great leader in providing that education and information and access to information on their website. So where does that leave us? Well, what we told you that we were going to do is the next step was going to be really to come back to do a review of our ordinance as it exists right now and come back to you with some recommendations for some ordinance revisions. And so what we have for you today are those. We have some suggestions. We have some things that we'd like to review with you as far as some actual changes. These are concepts at this point. We have some beginnings of draft language that we are starting to work on, but it's really the intent that we want to share with you this afternoon. So at this time, I would like to turn it over to Alicia to describe that process and then share with you the changes that we've are bringing forward.
Hi, good evening. I'm Alicia Klura, Assistant Public Health Director. As Jill mentioned, I'm just going to review briefly the process we've used the past few months. We've worked with closely with the City Attorney's Office in drafting some changes, and we've also vetted it with various leaders in our daycare regulation industries, such as the Department of Social Services at the state level. And so they've been reviewing our proposals and have been supportive so far of what we have put together. One of our final to-dos within this process was to reach out to daycare providers directly and give them the opportunity to review the recommendations and get their feedback. So in January we did that, and we sent letters to all of our 400-plus city registered providers and invited them to a meeting. We had a good turnout of 27 providers to provide us with feedback, and so as I go through some of our more substantial proposals, I'm also bringing a summary of the feedback that we received from the providers for you to be aware of as well. I will also note, as I did when we met with the daycare providers, that this is not an exhaustive list of every change that we're going to recommend. Sometimes the change may not have a direct operational or financial impact. We wanted to really review those items directly with the providers, but if they weren't going to be as impactful or clean up language type things, then we did not bring those that evening. So the first concept that I wanted to bring to your attention is the reporting of incidents, section 19-128.4. In our current ordinance, there are several areas that require providers to notify the health department of incidents in the daycare home. We've extended the language to include parents. So for example, if a provider has a new registered helper, or if they have used an unregistered substitute helper, or if there are any allegations of abuse, then we would ask that they notify the parents in addition to the health department of those circumstances. Additionally, we've added that if there are enforcement actions such as notice of violation, citations, revocations, that the daycare provider would also share that information with parents. When we reviewed this particular section the night of our provider meeting, we had very little, if any, response to this one. There were a couple like this where we didn't have any response, so I don't have any feedback to share with you on this one. The next concept I'd like to bring forward is inspections, section 19-132. Again, within our current ordinance, this section states that the daycare home must be open to inspections during business hours by law enforcement or code enforcement officials. And we've added the language to include parents as one of the entities that would have access to the home. This proposal probably generated the most conversation that evening, and there was a mixed response. Some of the providers felt that this made good sense, that this is part of their practice, that they give their parents tours of the home, and of course they would have parents into their home anytime. But there were also some concerns with just some operational issues it could cause. So for instance, it's very important in their business to maintain a schedule with a scheduled nap time, and there was concern about being able to minimize disruption during the day if people could come at any time. Also, there was some concern about having to open up non-daycare portions of the home to inspection. And there was also a concern that if a parent did come and want to look through a home and the provider needed to do a tour, that the children could be left unattended. So those are some of the pieces of feedback that we received from the providers, and that's what we were looking for, is what are some of the unintended effects that these proposals could lead to. But certainly our intent is just to ensure that parents have that access should they choose to inspect a home. The next section is a section for liability. It's section 19-123. This is a new section to the ordinance. This section would prescribe a minimum of $1 million in liability coverage for the family daycare home. Now, I've tried to do as much research as possible to bring you an estimate of the cost impacts of this. Through my research, it looks like the estimated cost to providers would be $400 to $1,100 a month. The high end, though, would be more due to if a provider, let's say, had a 24-hour operation, or if they transported children. This could cause you to have a high premium. From all that I could gather, $400 to $600 is the most common amount. There are numerous variables, but I did just provide an example here. So 8 children with a $600 a year premium, would be $1.44 per child per week. Overall, the feedback during the meeting was good and the provision was supported. When I asked for a show of hands, I'd estimate that about 2/3 of the providers that evening reported that they were carrying some type of insurance for their home business. We had a couple of providers that were sharing their premium rates and offering contact information to the group. Now, since that meeting, I have had some people reach out to me by phone or email with some concerns. It's natural that people feel more comfortable to bring that privately. Some have had concerns with the cost of that, and that it would be a lot for the provider to absorb, and they may have to in turn increase their rates. And others, while they say they understand it, they understand the need for it, and they agree, they feel that the $1 million minimum is too high, and that level of coverage would be too expensive. Section 19-131.1. This is a concept that would address a reapplication after a provider has been revoked. In our current ordinance, this is an extreme example, but we could revoke someone one day and the very next day they could reapply, and we would need to give that application the same regard as a new provider. We really feel that if there is a condition in a daycare home that warrants revocation, that a minimum 1-year revocation would be appropriate. And this is in line with the practices of the state as far as when they revoke their voluntary registration. It is for a minimum of 1 year. We've taken it a little bit further, though, and added some proposed language that would require that provider to also develop a mitigation plan for whatever caused the registration to be revoked, and that plan would be reviewed by our Board of Health. And the board could also, in fact, require conditions to be placed on that application should it be approved. So, for instance, a condition could be increased education. Overall, I felt that there was support that night by the providers. They agreed that a revocation should have a minimum time frame attached. The one provider that spoke to this a little bit said, I would hope that this would never happen to me, but I am concerned, what if it did happen to me and I didn't agree with it? And Paul Bangford from the city attorney's office was there that night, and he explained the city's appeals process, and that did seem to satisfy the questions regarding due process. I don't have a slide for this, and I apologize, but I did want to bring up a section that we have had We weren't intending to make any changes to it, but as of late, we've had several phone calls and emails regarding Section 19-128.2. This is a section that really defines the terms in which an unregistered substitute provider could be used. So, for instance, in an emergency or a doctor's appointment, the provider needs to step away and they can use an unregistered substitute. The provision also says that planned events such as vacations or planned medical leaves, they could not use an unregistered helper for that. We've had a lot of concern that the way this is written, that anyone could be restricted from visiting the home, including parents. And so we're really working through those emails and phone calls, and we wanted to let you know that we did send a letter to providers in the form of a question and answer to try to clear up a little bit of the confusion around that. But it could also be that we may bring language that could clarify that, because we certainly don't want parents to feel like they can't visit daycare homes. In fact, we want the exact opposite. So we're working on that as well. What we did strengthen around helpers is that we wrote some language that if the person is in any way employed with the daycare home, that they need to be registered. So with that, I'm going to reintroduce Jill, and she's going to talk through some fee structure concepts for you.
Okay. Lastly, one of the things that we have been striving for is how do we look at all the tools that are available to us, whether it be within restructuring our city ordinance, what we have in place as far as ways that we can procedurally enhance the expectations of daycare providers, or is there something that we could do to require things like maybe more education of daycare providers before they even become registered with the city of Sioux Falls? We looked through all those items. We've done a lot of research. Alicia has, Luann has, and worked and reached out to others in the beyond even the state of South Dakota. And what we've really found is that we have probably opportunity within our own relationships that currently exist that could possibly lead to, I believe, very strongly could lead to some enhanced quality. And so with that, I'm going to share with you that we are looking at recommending a revised fee structure for family daycare. And that fee structure, if you look, it will be tiered based on whether or not you're state registered. So I'm going to take the second bullet, and I'm going to take that to the end of my talk on this particular slide and go to some of the reasons why we believe that. About 51% of our family daycares within the city limits are already state registered. That's so of 420 daycares, it's around 210, a little more than 210, that are already state registered as family daycare voluntarily. We also know, based on what we have collected internally with our research, is that we have about 75% of our complaints are generated from non-state registered family daycares versus 25% of complaints registered with us that are with state registered daycare. So that just what we found is that we are able to see fewer complaints if they're state registered by a 75-25 difference. We also know that with our work with the state and trying to be as streamlined as possible with family daycares, that it's a very simplified process from a staff time perspective with our department if they're state registered, because we accept that state registration and we do so on their first registration as well as then the renewal process. So that becomes much more simplified, streamlined. The communication back and forth between the state is really very good, and so that ease of registration and renewal is much greater when they're state registered. Because of our memorandum of understanding with the state as well, we know that increased communication is now existing with the state and those daycares that are registered. So that has allowed us a better oversight, and when we're doing things such as inspections and those kinds of activities, that we are able to coordinate and cooperate with the state, and along with many other items. The other piece that we know is that with state-registered daycares, the state has several items and requirements of family daycare that the city of Sioux Falls has not put into city ordinance. And those are things around, there's some case management that's offered to family daycares at the state level. If they, there's items that they are eligible for, like food subsidies that they're eligible for if they're state registered, but that also comes then with some expectation around meal planning. They are inspected based on those items, as well as there's some additional language and requirements of family daycare where they can provide oversight on daycares for like certain disciplinary actions that we don't have in our city ordinance. Just to name a few items that are in state registration requirements. So with knowing all that and evaluating that and analyzing that, what we also have determined to talk now about the review of our current fees is that right now our fee is currently $15 annually if you're or if you're city registered. It costs you $15 to register and $15 annually to renew. That has been in place since 2004. That fee has never been increased. We have talked about the idea that that may be increased at some point, and that's what we're bringing for you here. We also know that what it costs us to run our daycare program. It costs us about $240 per daycare for all the expenses of the activities that go along with both registering and inspecting and all the enforcement around family daycare. So that's around $100,000 annually in our budget. And of that 100,000 or so, 45,000 is in our contract with Sanford Child Care Services. We provide the opportunity for education, the education requirements that are in ordinance, that is provided free of charge if they use Sanford's child care services for their education requirements. And that's costs the city about $45,000 a year. That's covered. So it's a nice benefit to the daycare providers. So with that, we're not recommending today. I share the expense with you because that's oftentimes a question that comes up. How much does it cost us to run the program? But I'm not expecting and I'm not asking that we cover the cost. We know that having ordinance around family daycare, having requirements around family daycare is very important, and we know it's important to assure that safety to children in the community. So like we do for restaurants where we try and cover the costs of that licensing and inspection, we are not expecting that today. However, while I don't have an exact number to bring you, I am proposing that we have a two-tiered process whereby we would take that $15 annually, increase that just a little bit, and that would be the fee if you are also state registered. If you're not state registered and you only are registered with the city, that fee would be higher. I will bring an idea of those amounts to you, but that it would be a higher amount to encourage and to then also gain the benefits of increased quality over time if we can get more of our city registered daycares if they would and have them be also state registered. So that's what we have and are proposing with this structure. We have, I think you shared that at the meeting as well, right? And there is a little bit of concern about raising the fees from the daycare providers. A few say while they understand that they understand the fee increase, others say that an increase in rates would be a hardship for the providers, and we understand that. So we'll be very cognizant of not raising those too high to create difficulty with even having people register in the first place. Certainly, our focus is on the safety of children, but there was some concern that that we should maintain just a focus on safety of children and not try and be profitable with our registration fees. And we certainly are not intending to be profitable with our registration fees. So that's what we, the two-tiered system also was a little bit of a mixed reaction as well. You know, some of it was, we also at the same time that we held this meeting, there was also a Senate bill before the legislature, the Health and Human Services Subcommittee, I believe it was, and I think there was a little bit of confusion between what we're attempting to do and what was going on at the state level. And so some of the questions that came about, I think, are probably related to that confusion. But we will continue to seek out input from our providers as we move forward with this process and look at these ideas and proposals to you. So my last slide here is just to share what's our intent. And I would really like to make sure that I am very clear as to what the intent is of these recommendations moving forward. The current ordinance, as well as any proposed changes, are not designed to impede the business of family daycare. They are also not intended to inhibit the involvement of parents with their children while in family daycare, rather the opposite. We are strengthening through these recommendations and proposals the opportunity of parents to have more information provided to them about their family daycare, to have the opportunity to inspect their family daycare at any time they choose, as well as to just have, in general, more information about the care that their children are being provided. This is, however, intended to clarify the role of the health department when elements of this ordinance are not complied with and we need to suspend or revoke a registration, to encourage a higher standard to be met through state registration and assure that helpers are properly registered, including to include liability provisions, and lastly, as I mentioned above earlier, to increase parental involvement. So with that, that is our presentation. We have next steps identified. We've tried to be very strategic and planned out in how we manage these next processes. We're hopeful that you will want us to perhaps either come back here based on your interest in knowing more at this level, at the committee, or perhaps at informational. We'd like to be able to come back in March, either here or at informational, if there's any recommendations you have for any considerations that you have. We would include in that presentation then the fee recommendations and the actual ordinance language of the sections of ordinance. We would be hopeful then that perhaps by April 2nd we would be at first reading and then second reading to follow. So just to give you an idea of the timeline we're working off of. So with that, any one of us would be available for questions or comments.
Jill, before we start questions, I know a lot of daycare providers have contacted myself and maybe a lot of the other council members and had stated that they have a lot of hard times trying to get to these meetings due to their doing business. Could you state, for the audience, maybe a phone number or an email address that they can reply to?
Sure. They can call 367-8760. That's the health department number, and they can ask for Alicia or Luann. They could ask for myself, any one of us. And the other option would be to, is it all right if I give them your email?
Do we have a general health email address?
Well, I'm going to give them Acollura, Acollura, siouxfalls.org. So that was ACOLLURA Thank you.
Any questions from the committee? Councilor Urfenbach?
Yeah, a couple. Jill, thanks for doing this, and Alicia too. I know you guys went nuts with the research and all of that. I appreciate it. Couple of questions that I have. Some of it based on input I've had from providers. One is the $1 million insurance policy. I get it from my standpoint as a parent. I want them to have all the insurance they can possibly have. But from their standpoint, it's a little different. My question is it somehow related to their homeowner's insurance? Is there a rider they can put on their homeowner's insurance? And then why is $1 million the magic number? What's the thinking behind that?
That was one of the reasons Paul Bangford is here, so I'm going to ask him to come forward and answer
great.
your
Thank
question.
you.
Thank you, Councilor Erpenbach. You know, there have been discussions about what's the appropriate amount of money to put for liability insurance, and there are several different code sections where different liability insurance is required for different amounts. An example is in Ordinance 6-3, if you're going to have an amusement ride in Sioux Falls, they need to have a $1 million policy indemnifying the public against damages sustained from the ride. If you're a garbage hauler in the city of Sioux Falls, under Ordinance 1871, subsection 8, you have to have a $1 million commercial liability policy per occurrence, or $2 million aggregate. There are other examples, though, of lower insurance that is required. An example in Chapter 7 for vicious animals is that we require $100,000 liability insurance, or pest control license, $100,000 insurance. So there are varying amounts. One of the things, and we're still looking further into that, is, okay, if you reduce that amount, you reduce it to $500,000 or $250,000, how much savings would that actually be to the daycare provider? It isn't going to be a 50% savings, and that's an angle that we're continuing to look at. I know that some contacts have been made to make inquiries in reference to that dollar amount. I can't give you a specific amount now. You know, part of it is we're looking at children, and you know, lots of things can happen, and so what's an appropriate amount of liability insurance? Certainly, we think that, you know, at least as a starting point, $1 million is a good discussion for that. There's certainly examples throughout the code where that amount is set forth. But that being said, if the thought was that a different amount would be appropriate, I guess one of the pieces of information that we need to give to you that we just don't have right now is, okay, if it's $400 to $1,100 for $1 million, what's the difference if you go to $500,000? If that's $70 cheaper, you know, maybe it's better to keep it at $1 million. But if it's a significant price difference, you know, certainly any input or thoughts that you have can be looked into. But that's why $1 million was arrived at, dealing with, you know, the fact that we're talking about children and children being potentially injured, and there are examples in the code of other industries that we require that type of insurance, although there's certainly examples that we require less also.
Good, thank you. And as you said, Paul, because it's related to children, and I did have children in daycare, I mean, $1 billion is the, you know, you can't put a price tag on it.
Right.
So.
And I know Alicia herself had talked to an insurance agent about it and was looking at the price differential, and I know that particular insurance agent said that he didn't have clients who had under $1 million for daycare, and so he couldn't give her an exact quote at that time about what $500,000 would be or $100,000. We'll certainly bring back more information related to that, but we just don't have those figures for you right now.
Great, thank you.
Thanks.
Then if I might, Mr. Chair.
Please.
A couple questions for either Alicia or Jill. What does it cost to register with the state? I know it's voluntary, but is there a cost to that?
There is no cost for the registration or the renewals at the state level.
Okay. That wasn't the answer I expected. Okay, so I don't know where I'm going with that then. What then is if I'm going to open a daycare, what's my incentive to register either with the city or the state? I mean, and if I don't, what are you going to do about it?
Well, certainly if you register, and I'm going to answer part of that, but I also think it would be helpful for Luann to fill in any gaps as well. So I'll give it a start. First off, I can speak to the city that you require it in ordinance to be registered, so certainly to be complying with that. And if you're not registered and we find out that you are, so there's a couple different ways we do that. There's different methods that the inspectors will use to try and find out if there's people that are providing daycare services and not registered. So they'll do that by looking through like maybe the ads, things like of that nature, where they see somebody who is putting themselves out to run a family daycare, but they've then cross-referenced it with our registration and find they're not registered. So then they may reach out to them and say, I see you're going to be starting a daycare. You may want to become registered if you haven't already, since you haven't started the process. Annually, when we do the renewals, we'll have a pretty significant number that perhaps are not necessarily renewing at the time that the deadline is to renew. So that then stimulates the process to go through each one of those that were renewed in the prior year, not renewing for the next year, to ascertain which ones have decided to no longer, maybe throughout that year, stopped and didn't notify us, or at that end of year have decided to stop their daycare operations, or they're continuing to operate a daycare, but they're not renewing their registration. So then we go through a very similar process that we would do for anyone who needed to either be licensed, permitted, or registered, and work with them to get that done as quickly as possible. So the benefits, since there is no, it's voluntary to be registered at the state level. Yeah, you might ask yourself, why are half of the providers, doing that? And there are several reasons why it's beneficial. There are certain incentives that they are able to take advantage of. I don't know if that's the right word to exactly call it. And I think I'd like Luann just to come up and talk a little bit about that.
Hello, I'm Luann Ford, Public Health Manager for the Health Department. Your question is why would someone choose to become state registered? I can speak generally on the program that they have, is that they do offer, like Jill said, an incentive, which is a food assistance, and so they can help providers with the cost of food for the daycare, and then along with that comes an obligation to serve nutritious meals. They also require, if a child is getting state assistance, so if they're getting assistance for daycare, to help them pay for daycare, that child needs to be going to a state registered facility. And those are two big reasons, and there's also a level of professionalism that the state provides also to their to the people that are registered, in the fact that they do have requirements that the state or that the city does not have, that they ask the providers to meet.
Then if I might, just one more question, Mr. Chair. If I'm a parent looking for daycare, and I know that I can find the city registered ones on the city website, can I then also find the state registered ones on a state website as well? So that's part of my process of shopping, maybe?
I don't believe the state has a list on their website. However, I believe 211, the helpline, does make note if a parent contacts them as to whether or not a provider is state registered as well.
Okay, good. Thank you.
Councilor Braun?
Luann, don't go too far away. Maybe Jill can answer this, but then we talked about the benefits of the state, but what about the city? What value do they get for being licensed by the city?
Did you have something?
I wanted to speak to Michelle. I can come up and do
Okay. Well, first off, the benefits of the city is, with the requirement to be registered with the city, there are certain educational requirements that allow you then to gain a better understanding of how to care for children. So there's safety education that you're able to receive, and as well as other education that's required both to become registered as well as annually thereafter. One of the benefits is that you're able to access that free of charge, and so it allows you to become more educated as a provider, but also then is no cost to you to do so. Or it's the $15 registration that really doesn't begin to cover that cost, certainly, as you heard here, but is a really big benefit to providers, because we do find that is of a value to the providers to be able to get that free of charge. There are also other, we require a TB test, but we don't require that they pay for that. That's also free of charge. What else am I missing? Is that pretty well covered as far as benefits? I think the other thing, too, is the city has been very progressive. You as council and councils before you have been very progressive in your stance on wanting to assure that family daycares within the city of Sioux Falls are registered, so that you know who those providers are and can have some basic requirements of them. I think that is a real benefit to our daycare providers. They may not feel that way necessarily, but I think it does set them apart. When you look at the standards that are out there across the country, we know that South Dakota lags far behind many states in licensing, registration, the requirements, standards around family daycare. And so Sioux Falls is a great example of where that is not the case like you would see in the rest of the state, that we do require that, and I think that is a benefit to our providers.
Mr. Chair, another question, if I may. And it's one that you can't answer, Jill, but we know we have 420 city registered. How many are out there that aren't registered?
That's a good question. We hope not very many. I'm always so impressed with Nick Miller and Todd and the work that they do to really try and look for those that are unregistered. They have a lot of different tools they've developed over the years of doing this to be able to try and find those providers. And they really know the group of providers and any activity around that. A lot of times it's someone who maybe has been providing it in the past that they know of and then is not registered, and they somehow find out that they're, again, providing daycare, and they really do a good job of really sifting through all that. So, but you're right, I can't answer that question, but I would really hope that through the work that we've done and as the years have gone by and we've refined the operations of overseeing family daycare, that's hopefully minimal, because we also have a great community that wants to make sure kids are well cared for, and so we get a lot of calls, as well from neighbors and others that say, I'm not sure if my daycare next, I think there's daycare operations occurring next door and I don't see that they're registered, and so I'd like to let you know about that. Can you check into that? So that's just one other method that we have.
Any other questions from the committee? Jill, could I have you give out that contact information again, please?
Sure. The number for the health department is 367-8760. And anybody who calls can just say they have a question about family daycare ordinance revisions, and the folks will try and find whoever's available to visit with them. Otherwise, also, they can email acollura@siouxfalls.org.
Thank you very much.
Yes. If you don't mind, Alicia had one comment just to answer more fully a question that one of you had.
Yes, I just wanted to speak to your cost question, because while the state registration is free, I wanted to find out if there were unexpected costs with that. So I did ask them what in their process could potentially be a cost to the providers, and there were several things. The state registration process does require a health report, so that could be a medical visit. If there are things within the home that are not quite in compliance, such as smoke detectors, outlet covers, and fire extinguishers, that could be a cost to the providers. If they have a room that is not properly exited or has an improper window, then an egress window type of cost could come into play. I don't believe fencing, I'm not sure the exact requirements on fencing, but it did say that fencing could be a potential. And then other requirements such as are the railings, the proper spaces apart, and things like that that you see in a modern day home inspection and with the housing code. So those are some of the costs that are not quite as evident.
Good, thank you.
With that, any comments? Councilman Brown?
We have a couple guests, if they wanted to speak. And
I
I
was
would like
gonna
to hear
ask
from
for-
Dr. Randall, her thoughts on this as well.
I was going to ask for public comments on this. Do we have anyone from the public that would like to speak on this issue at this time?
Committee Chair and members of the council, I'll be fairly brief, but just to say that we started a child care safety and quality initiative back in September. Thank you, Councilman Aguilar, for joining that group at that time. We have learned about these steps to strengthen the city ordinance. We think it's a real positive direction and commend the department for their due diligence in finding ways to strengthen the ordinance and also connecting with providers about it. I know that from a standpoint of parents, these measures that will strengthen parents' ability to be good monitors of child care is really a plus.
For the record, could you state your name, please?
Oh, yes. Sorry about that. Susan Randall, South Dakota Voices for Children.
Thank you.
Thank you.
Any other questions from the committee for Dr. Randall? No? Any other public testimony that anyone else in the group that would like to speak to this issue? No? Okay. Open discussion by the committee. What would you like to do with this issue? Councilor Aguilar?
I'd like to see it go directly to an informational. And Counselor Erpenbach, I think you had an idea of...
Well, I just think, if I might, Mr. Chair, I just think it helps us as a council kind of gel that information if the informational session is closer to the first reading, you know, either the night of the first reading or the week before. You know, so if you want to kind of coordinate that in your strategizing, that would be great.
Councilor Brown? Have any comments?
I like that approach.
Okay, do we have a motion?
I would move approval and then comment.
Second, Aguilar.
Okay, all in favor, say aye.
Should I comment?
Could I just comment on
Sure.
that first? Because I did have comments from daycare providers. They were very concerned about, as you said, their ability to speak to the council. I would remind folks that if they're planning to speak to council about this, that the second reading during a 7 o'clock meeting, to watch those agendas and look for the second reading is when the public can speak to these things and speak directly to the council. So that would be my one comment.
Okay. With that, we'll need a vote on this. All in favor, say aye.
Aye.
All right, this will move to an informational then. And for those out there in the viewing public, at the informational, we'll be giving more information on this as far as the changes to the ordinance and fee changes. But if you still have questions, please contact the Health Department at 605-367-8760. Thank you. A motion to adjourn, please.
So moved, Erpenbach.
Second, Brown.
All in favor, say aye.
Aye.
We are adjourned.